Hello, welcome to PCR London Valves 2025. I'm Chris Allen, and I'm delighted to be joined by Raj Makkar, Cedars-Sinai, Los Angeles, USA. And we're talking trials. We're talking specifically trials for the treatment of native aortic regurgitation with transcatheter devices. Raj, thank you so much for joining us.
Pleasure.
Congratulations on the study, Align AR, and for its simultaneous publication today in The Lancet. Could you start by outlining what the main question of the study was you were trying to answer?
So Chris, we wanted to find out what are the outcomes in patients who have moderate to severe or severe native aortic regurgitation, in patients who are high risk for surgery. So Align AR enrolled these patients, and this was a single-arm, multi-center pivotal IDE trial, non-randomized of course, where we recruited patients who were high risk for surgery. These patients were 80 years of age on an average, had an STS score of about 3.8, and we implanted the valve and we looked at the outcomes, the clinical outcomes, as well as the echocardiographic outcomes and patient-reported outcomes. And essentially, what we found was that the procedure was generally safe. In 700 patients, we had zero mortality during the procedure. We successfully deployed the valve in 98% of the patients. We were very effective in reducing aortic regurgitation. So at the end of the procedure, practically 99% of the patients had mild or less residual moderate regurgitation, total aortic regurgitation, and that continued to be the case all the way up to 2 years. So I think what we found was that the procedure was safe. Intermediate outcomes and outcomes up to 1 and 2 years were also quite acceptable. So when you look at a 30-day mortality of 1.6% in the patient cohort where the expected mortality for surgery was 3.8%, even if it is non-randomized, it does give us quite a bit of confidence.
Absolutely. Some outstanding results there. So this is a dedicated device for the treatment of native aortic regurgitation. Could you tell us a little bit about how it works and perhaps contrast it with the off-label use of TAVI valves?
Yes. So this device is engineered to anchor in non-calcified aortic leaflets, and its hallmark is 3 locators which essentially clip on to the aortic leaflets. So you anchor not only in the annulus, but also at the leaflets. And that is what has been so effective, unlike the off-label use of devices, which is characterized by almost 10 to 15% risk of embolization and almost 15% risk of moderate or more residual aortic regurgitation. This device was able to cut down the embolization rates to like 1.2%. And of course, the residual aortic regurgitation of moderate or greater severity was only 0.5%. So that is the stark difference. And when you look at the off-label use of devices, typically the observed mortality in this series is actually more than what the STS risk was.
Yeah.
In contrast, as I mentioned earlier, the mortality here was less than half, 1.6 compared to 3.8, what was actually predicted.
Superb. And so perhaps we talk a little bit about the implications of the study. Where do we go from here? Where does the field go now?
Well, what we have shown is that this is an excellent option because of good acute outcomes and good outcomes all the way to 1 and 2 years. We have excellent valve performance. We have improvement in functional and quality of life scores in these patients. And we also had impressive data on LV remodeling. I think these data are convincing for us to use this device in patients who are high risk for surgery, but because currently a lot of patients are not being treated. But at the same time, I think what we have now is a device that we feel comfortable with in testing it in patients who can actually undergo surgery. So we have already started the ARTIST trial, which is randomizing patients who are acceptable candidates, low-risk surgical candidates to either TAVR with this particular dedicated valve or to surgery. And this is going to be a 1,000-patient study which will help guide treatment in these patients in the future.
Wonderful, and we'll watch that space very closely. So there you have it. We've seen the results today of a dedicated transcatheter device for the treatment of native aortic regurgitation. Very impressive efficacy at acceptable safety, and the wheels are already turning on the next stage, looking at patients who could otherwise have surgery. Thank you very much for joining us.